Okay. Could I have the room quiet, please? Okay. My name is Paulette Nichols, for those of you who I haven't had the pleasure to meet yet. I do see a lot of faces of people that I do recognize. I'm going to be your facilitator for the day. I'd like to welcome all of you to this important event. It's the second global partnership on children with disabilities, and I understand many of you were here last year. Briefly, let me just give you my background. I worked with UNICEF for over 20 years, and mainly at country offices, including Sudan, Angola, Togo, and I spent the last 5 years here in headquarters as a program planner and program policy person. I also, before joining UNICEF, I worked many years, I think maybe 10 or so, with a number of NGOs, including the Quakers in Africa. Now, as your facilitator, if you have any concerns or questions, you can catch me in the side here during the coffee break or lunch, and feel free to talk to me about anything that any difficulty or question you might have or concern. We are going to keep a tight rein on the time today. It's a lot of things that we have to cover. So now I'd like to introduce our first speaker of the day, Dr. Nicholas Alipui, the Director of Program Division for UNICEF here in New York. He's someone who I've known and worked with for many years. I don't want to tell you how many. I start talking about age and we get a little confused here, but trust me, he's been in UNICEF for more than 25 years. He served as a country representative in the Philippines, in Kenya, and he's now the director of our program division, which is the largest division in UNICEF, and he's been doing that job for the last 5 years. So without any further delay, I'd like to introduce Dr. Nicholas Alipui.
Thank you very much. Good morning, everyone, Excellencies, colleagues, and friends. It is indeed a great privilege and an honor for me to be with you all this morning again at the opening of the second forum of the Global Partnership on Children with Disabilities. I also had the pleasure in September last year to open the first forum of the partnership, and I would like to start by congratulating each and every one of you in your respective capacities and collectively for your achievements during the last year, working together to make a difference in the lives of children with disabilities. At UNICEF, we firmly believe that all children have unlimited potential. Seeing disability before seeing a child destroys that potential. Children with disabilities carry the promise of happy, meaningful, and vital community participation, and of making contributions to build inclusive and sustainable societies. Yet, children with disabilities continue to be excluded from schools, from living and participating in community life, from accessing health care, and so many other basic social services. Their rights continue to be violated each and every day, especially children with developmental impairment, and more so during times of humanitarian emergencies. A society really cannot be equitable unless all children are included. The partnership that we all are so proud to have brought to life can play a vital role in making this a reality. The Global Partnership on Children with Disability is very important to UNICEF. It is heartening to see the significant strides that the partnership has made during the last 1 year. The size of the partnership has more than doubled since 2012, and now we have more than 500 members from 230 different organizations from around the world, representing diverse groups like governments, national and international civil society organizations, non-governmental organizations, associations of persons with disability, UN agencies, academic and research institutions, and others who are actively working together to achieve results for children with disabilities around the world. Let me share a few examples of the partnership's achievements just to get it started and the efforts that are being made worldwide. First, efforts of the partnership and its task forces have led to the Global Partnership on Education having global indicators specifically on inclusive education for children with disabilities. Second, the Nutrition Task Force, in turn, has conducted the first global survey on nutrition activities that specifically address disability. And third, children with disabilities were included in the Disaster Risk Reduction Platform, global platform, and the outcome document. The second forum of the partnership is happening exactly at the right time and is very timely, since there are a number of important processes currently underway where the collective voice and action of this unique partnership is critical. I would particularly like to point out the discussion around the post-2015 agenda, which is at a crucial phase at the moment. UNICEF calls for strong attention throughout the post-2015 agenda discussions to the rights of the people with disabilities, including through disability-specific targets and indicators in all of the goals that we've set for ourselves. All targets in relevant areas in the new agenda should be disaggregated by the most appropriate characteristics for that target in order to reveal and track inequalities more deliberately than we have done in the past. Among these characteristics are gender, geographic location, age, household, wealth quintile, ethnicity, and very importantly, disability status. Data collection and disaggregation for these targets should be complemented by extensive qualitative input and feedback on progress and performance from deprived groups and communities themselves, including people with disabilities. This will help further our global aspiration and inspiration in the words of the Secretary General's high-level panel that we leave no one and no child behind. We also have the outcome of the high-level meeting on disability, which needs your active support to be implemented locally, nationally, and globally. In addition to the significant advocacy role, the partnership is key to supporting inclusive programmatic action globally. At the end of the day, we would like to see a world where the norm is for nations to conceive and implement policies and programs in health, nutrition, early childhood development, education, child protection, and others that are inclusive and that benefit all children, particularly those that need these services the most. Social protection systems need to pay particular attention to the specific needs of children with disabilities. Humanitarian action needs to be informed and influenced by an understanding of the particular needs of persons with disabilities. Getting to this point means that our collective instinct should be to place children with disabilities together with other marginalized and excluded children central in the design, communication, implementation, and monitoring and reporting of all our programs. It also means timely and appropriate investments to ensure a continuum of opportunity and support to all children and their families. It is time for us all to pause one moment and ask ourselves how we measure the success of our programs and what we do for children. Surely the marker should be whether or not these programs have helped the most marginalized children, including children with disabilities, to flourish and to pursue their own ambitions and dreams. Not least, the measure of our success should be reflected in the extent to which our collective actions have helped transform deeply entrenched stigma and discrimination into inclusion, tolerance, and acceptance. UNICEF is committed to supporting the global effort to break down the barriers that prevent children living with disabilities from full participation in society. Our flagship publication, the State of the World's Children Report, which in 2012 focused on children with disabilities, was the first global report rendering visibility to issues of children with disabilities. We are really very proud of this report and are very pleased to note that this publication has helped ignite the conversation on children with disabilities worldwide and has deepened the policy discourse around children with disabilities, including in UNICEF itself, where we've reflected in our own strategic plan 2014-2017, explicitly reaffirming our mission as one that promotes the rights of every child everywhere, with an emphasis on the most disadvantaged and excluded children and families. On that basis, disability is integrated across all our sectoral programs, all our partnerships, and all our operations at field level to make sure that no child would be denied an equal chance in life. As an organization, we are committed to collaboration and partnerships. The world for children is dynamic. It is moving fast, it's complex, and full of opportunities, but also threats to children's lives. We know that it is only by harnessing the expertise, the experience, and the reach of a wide range of partners that we stand a good chance to see better results for children worldwide. Our combined efforts can achieve so much more than we can, each acting individually. Let me end, ladies and gentlemen, by emphasizing a plain truth, that universal human rights can be realized only when societies are inclusive, when there are no barriers to a child's fullest participation, and when his or her abilities and potential are valued, nurtured, and groomed in all societies in which we live and work. Together, we can ensure that children with disabilities have an equal chance to make the most of their lives, and in so doing, build a better world for all of us. Thank you so much, and I wish the forum great success.
Thank you, Dr. Alipui, for encouraging all of us to jump higher, reach reach farther and run faster at this defining moment in time when we have the post 2015 development agenda underway, the planning for that event. Okay, now we are a little bit behind time. Thank you, but we'll make up for it, I promise. I do have to take a couple of minutes to go over a few of the housekeeping issues, just some of the basics about the way we're going to operate. First of all, let me direct you to your folders. You have the agenda in there, which gives a clear understanding of what our objectives are for the day. I'm not going to read these out because, again, we're running a little late. We also have in there the annual report, and you will have the jot down cards, what I'm calling jot down cards. These are the yellow Post-its. The yellow Post-its. Everybody should have some of these in their folder. These we will use throughout the day for you to jot down your questions and your comments. We have volunteers in the blue T-shirts who will come around and collect them. And we will be clustering these cards into the different themes that are emerging from the discussion. And we will try to use these cards to respond to people's concerns and questions, particularly during the plenary sessions. I'm sure you can appreciate there are many of us in the room and upstairs as well. And this is one of the most efficient ways that we will be able to collect everybody's concerns and questions. And even if we don't get to the response in the session, you should feel certain that we will use these comments and your questions to finalize our report. And many of your comments will be helpful in establishing an action plan, which will be elaborated after the forum. The second card is the purple card that's in your folder. This one is an idea that we think will be useful for both the organizers and the participants. We'd like for you to use these cards to jot down your ideas as they come to you during this day on what you think you or your organization can do to promote an inclusive development agenda for children and adults with disabilities. And the three areas, and you're going to hear these three areas mentioned throughout the workshop, throughout the day, are government engagement, public awareness, and voices of children and adults with disabilities. You will then write your name and address on the other side of the postcard. At the end of the day, we will collect these, and we'll use them, we'll analyze the content, do a little bit of mapping, and we will send these back to you at a given time in the near future to remind you that you thought that the X, Y, and Z were a good idea. So now, let me get this straight. We have two locations, and this is very unusual for me. So we have everybody who's here, the participants, but upstairs we have a second group of participants in Danny K. We've done this to accommodate the number of registered participants. So, and we have a co-facilitator upstairs, Yuta Frike, who will be doing a little bit of what I'm doing. But unfortunately, she will not have a microphone. So if you see people coming down with the blue T-shirts and coming to me, they're delivering their input for the session. And we may have a little bit of a delay because everything is being live streamed up there, but it will be a little bit of a delay. So bear with us as we deal with this unusual arrangement to accommodate everyone. Let me also mention again that Wi-Fi is available. You have the password and the code on those notes on the walls. I'm not going to repeat it, nobody will remember it. But also, we are live streaming the event at livestream.com/UNICEF. Now, we also will have the cart, what is the cart? Which is basically a word per word translation of everything that's going on in this session, in addition to the presentation screen up front. And they have a similar setup upstairs. Let me go through a few logistics that are important for us. The elevators, in terms of the elevators, we have one elevator that's dedicated for wheelchair use. We have the wheelchair accessible toilets are located on the 15th floor. And the volunteers, once again, in the blue t-shirts, you will see, are here to assist you. We also have our translators, and I have to be careful because I tend to talk fast, so I'll try and slow down to keep our translators happy. Then I think it's necessary to say a few words about how we should be polite. Will people kindly turn off your cell phones? If you get a call, you can step outside and take the call. Please wear your name tags. And if you are called upon during the plenary, please state your name and organization. First, you should keep your questions brief, focused, and pertinent. And the day is going to be full of interesting and informative sessions, presentations, keynote addresses, and I'm counting on you to keep us on time, which we're starting off a little late already. So whenever you hear this, very pleasant, that will signal that we're 5 minutes before the start of the next session. And then I will time again when it's 3 minutes. So when you hear that, so we can begin on time. Let's see. And I will start the sessions on time. All the presentations and all the other materials that are going to be used in this day, throughout the day, will be posted on the Global Partnership website. You'll be asked to take 5 minutes at the end of the day to complete an evaluation form, and this will be collected. We really value your input, and this will be very important for the analysis and the report, which will be written after the forum and shared with all of you. Finally, I would be remiss if I didn't mention that I am not alone up here, nor with the translator. The disability team is here. They're wearing black t-shirts. Those are the staff members, and blue t-shirts by the volunteers. And they are here to serve and support the event throughout the day. We're really fortunate to have the dedicated number of volunteers, and I'm sure you'll appreciate them. And then finally, our conductor of the orchestra, which is Adzalla, will keep us all in tune. So I understand that Adzalla is someone that everybody knows, and I don't think she needs really an introduction, but it really does give me a great pleasure to introduce Adzalla to the podium, I know how that she is truly honored to introduce the next very special speaker. So, over to you, Adzalla.
Hello, everybody. Can you hear me? Yes. Thank you so much, Paulette. It's amazing to have all of you here again today. I think I'm nervous. But actually, I'm very, very inspired this morning. I'm here to introduce the first keynote speaker. That is an honor for us. But before this, I just wanted to use the time a little bit. This morning, I got a very special gift, which is a hummingbird that is something that is following our lives for many years. And I just feel inspired to tell a story why the hummingbird guide our lives for so many years. It's a story that comes up from Brazil, from a very important leader of the social movement there, and Betinho. And he used to tell this story that the forest was in fire, and all the animals were running away to save their skins, and the lion was running in front, leading everybody to leave the forest. And then he saw this hummingbird that would go to the lake, get 2 drops of water, go to the fire, drop the water there, and back and forth, and back and forth. And then the lion said, "But why are you doing this? Don't you see that you will burn, you will die, and you will not extinguish the fire?" And then the hummingbird said, "I'm just doing my part." I think it's a very important concept that will guide our work today, too. And I'm privileged to have the opportunity to introduce the first keynote speaker. This is Mr. James Wolfensohn. He was the president of the World Bank. I was very privileged to work under him there, and actually working under Tony Lake today, 2 big leaders that support inclusion. And basically, Mr. Wolfensohn was the one pushing inclusive development through the world. And if we are here today discussing post-2015, he was the first and very strong leader to allow disability into development. So it's my honor. And let's see, he could not be here today. This is very important. He came to UNICEF to record the message because he had something to do in China. He's there. He is watching us through live stream, and he would love to be here with you. He wanted to make sure he came here and he recorded the message. Let's see what he has to say. Thank you.
I feel very honored to be asked to address some remarks to this gathering of people who themselves are currently very active on an issue which has been of extraordinary importance to me. It is, of course, the issue of persons with disabilities, and within that framework, especially the problems affecting children, which I define as being under the age of 18. There are some 200 million people who are included in this group. And to my very great regret, in the last Millennial Development Goals, there was little attention paid, in fact none, to the issue of disability, and none, of course, in relation to children. Of the order of 25 years ago, I first became confronted with issues of disabilities when, for 5 years, I was president of the World Multiple Sclerosis Federation. That was as a result of my friendship with Jacqueline Dupre, who was my cello teacher. Unfortunately, I never achieved her level of skill. But as I saw her subject to the problems of disability, it became very clear to me that there was a need in relation to that particular problem to broaden out the approach. But when I came to the World Bank, I was astonished to find that the international community put in the shadows the much broader issue of disabilities at all levels, at education, at healthcare, at the question of jobs. And I became particularly concerned that in the case of young people, very little was being done to prepare them for the future. And indeed, without preparation, you could be certain that their future was very dark. this forgetfulness by leaders of an issue that in human terms is hugely important. And my hope in the work that I started at the bank was that we could wake governments up to the fact that they had a responsibility to 15% of their population, 15%, who are affected in some way by disabilities. This was not just a singular approach by someone who maybe had a special claim. This was an obvious approach for anyone with a sense of equity and justice who was trying to run a country. It's my hope that in the next generation of goals, there'll be explicit mention of the objectives that you have and that many of us who are interested have, and that instead of no mention, it'll be given priority. Most important, I want to say to all of you that this will not be achieved by any single group. But we have over 200 countries in the world. And what we need to do is to get them enthusiastic about this issue and look through the issues of financial capability and look at the issues of human responsibility. If we want our planet to be an equitable planet, and if we want it to offer opportunities, we must start with young people. And within the group of young people, we're not even yet doing a great job on education, but within the framework of education and health, it is essential that we mark out specifically that group of young people who have forms of disabilities very varied indeed. It's for us to think about the next years and see how we can come together, influence the decision makers, influence the policy makers, to give priority to an equitable need, an equitable demand, something that is right, just to bring equity and social justice to a segment of our community that at the moment simply doesn't have it. Your purpose in the meetings today will be to come together and from all the various perspectives of government, of civil society, of individuals representing those with disabilities, all of you need to come together today in relation to UN goals and in relation to the official institutions to try and ensure that we get specific statements, specific goals, and specific opportunities to assess how we're doing. We have to today think about the future. And we should come together at this meeting, proudly asserting the claims, the rightful claims of this group, and come up over the next period with some real plans that have global support, chief executive support of corporations, and most importantly, chief executive support of the countries with which we deal. So that next time we will have more heads of state here, that it'll be something that the G7, G8 will be concerned about, that the G20 will be concerned about, concerned in a positive way to ensure that an injustice from the past is righted for the future, for the benefit not just of those that are affected, but for the benefit of us all.
Thank you to Mr. Wolfensohn, and thank you for Adzalla. I'm really, really very inspired by the stories and the personal journeys that I'm listening to, and I've had the opportunity to speak with people in the audience. I think it's really, truly unbelievable that so many people have been involved in this struggle for so long. Let me now move on to our next session, our first session of the day, actually. And this is where we get down to the real business of what we came here for. The first session is going to be the overview of the first year of activities of the Global Partnership. And I'm happy to introduce Professor Nora Groce, who's going to moderate this first session for us. And for many years, I understand, she's been, again, a person for many years, involved in an important contributor to the issues, to dealing with the issues that really are improving the lives of children and adults with disabilities, taking on all of these issues at a global level. As an anthropologist and a social scientist, Professor Groce has published widely, and she is a professor at the University College London, director, Leonard Cheshire Disability and Inclusive Development Center. Welcome, Professor Groce. You will have a little over an hour.
Good morning. When Paulette said I have a little over an hour, what she means is I have a little over an hour to moderate the session and not talk for an hour. You will be glad to know. And actually, one of the nice things about giving opening remarks and moderating is that I can shorten my remarks and put us back on track. We've had an excellent opening statement and a very nice introduction from Dr. James Wolfensohn, and so I don't know that you need me to repeat what's already been said. Rather, let me make a few remarks and then ask that we turn the discussion right over to our presenters, because we have a small amount of time and a remarkable list of people coming to speak briefly on a number of different subjects. The growth of the global partnership over the past year has been nothing short of remarkable. This is an effort that has involved hundreds of people from around the globe, ably coordinated with, I should note, limited time, funding, and resources through UNICEF to bring together groups that previously often had little connection to each other and little connection to international organizations, although many of them have been doing remarkable work in their own right for many years. I should note that this is also a process that is not only long overdue, but that had been foreshadowed in 1931. There was an international conference at The Hague put together by something called the Society for Crippled Children, which after many iterations is today Rehabilitation International. And they sent to the League of Nations in 1931 two proposals. One was for a bill for the rights of disabled children. They called it the Crippled Child Bill. And the second was that somewhere within the League of Nations, an office be set up to bring together, coordinate, analyze, and disseminate information on disabled children that would help in policy and programming. Neither one of these efforts went very far, and here we are 80 years later. And it is only now through the dedicated efforts of the UNICEF staff over the past year and a half that we've finally pulled together an international alliance, a global partnership that is really fulfilling this long-held dream that there will be both commitment, leadership, and most importantly, action on behalf of disabled children around the globe. Let me, without further ado, start with our list of speakers. And then we will have, this session will be divided into two components. One will be a discussion of the functioning of the 4 task forces that have been underway, and a discussion of, well, actually, I think there's 5 task forces now, and then a discussion of another proposed task force, and a little time for questions. And then also a discussion of 3 of the national partnerships that have been organizing over the past year or so. Unfortunately, all the presentations are by necessity brief, and so each group or each speaker will have about 5 minutes, and we'll only have about 10 minutes for each block for discussions. But All the speakers will be here throughout the day, and if you're not able to catch them or ask a question during this session, then please feel free to come up afterwards or ask any of the UNICEF staff who have been very involved in this whole process. So, without further ado, I have the honor of handing over the microphone to Ms. Stephanie Hodge, who will present the first discussion. She is with the Task Force on Education, and she will give a quick summary of a lot of the work they've been doing in a very short time period. She has 5 minutes. Thank you.
Thank you very much. I'd like to thank, first of all, Rosangela for the leadership she's displayed and the platform that she's given us here at Education to actually fulfill the task force objectives. It's been an incredible year. I'm a marathon runner, and I know that sometimes policy agenda setting and actual results at this strategic level can take a long time. This, by far, has been a sprint, and this is for 2 reasons. One is the leadership that has been displayed by our leader and this partnership, and 2, the partnership, which is definitely a sum of its parts. The demand for change is here. We just merely jumped into the window for it. I'd like to now just talk a little bit about the results that we've had within the context of the task force, and I'd also like to express my colleague from UNESCO, who's co-leading this task force with me, unfortunately has been on a plane coming from Paris yesterday that was diverted to St. John's, Newfoundland because of technical difficulties and could not make it. So she is right now in St. John's in a hotel. But I want to express that really this has been a co-leadership activity of UNESCO and UNICEF together with the partners. And the results have been enormous. First of all, we set the goal really to influence the global partnership on education. This has been achieved. Not only did we influence the global partnership on education, but we actually managed to work with the partnership to articulate an indicator within their strategic implementation plan. This is enormous. At the same time, UNICEF also managed to articulate an indicator on children with disabilities within its new medium-term framework, corporate framework. This is extraordinary. This allows for us now to move forward in terms of implementation. Secondly, we contributed enormously through the partnership and the collective will of this group to the post-2015 dialogues at its early stage, the most influential stage. This has, again, been just extraordinary. The contribution, again, to the high-level meeting on disability and development in March, again, extraordinary contribution at a very timely time. The rollout of the knowledge community on inclusive education, this is the beginning. Again, this has been done with our partners at UNESCO, and this has really been the beginning of now creating a knowledge learning network for the implementation and the sharing of good practice going forward. This has been established. It's just now a matter of strengthening. Within that work of the knowledge community, we've also developed now a survey on Article 24 that will bring together the collective expertise from the partners and help us then shape global guidance on the issue and continue to influence the post-2015 process. These have been the highlight of extraordinary achievements. This has been a Usain Bolt activity. This has not been a marathon. This has just been really, really good work. And I just feel so good to be a part of it. Thank you so much. Challenges and recommendations. So I've mentioned a few of the challenges. Really, the challenges are really the time, commitment, and ownership. This is about will, consensus, and volunteer collective outcomes. It's about coming together, doing it more, and doing it stronger. So really, we want everybody's time, commitment, ownership of all the task force members to continue to play a sum of the parts for the implementation phase to follow. Communication amongst members and sharing of information, use of the knowledge community. Just make the community yours. It's yours. We're going to provide the platform, and let's continue to get the expertise into the countries and into the implementation as needed. Focus on implementation. This is our next step. Task force priorities. Again, this is a collective listing from members of the task force. But essentially, the priority is implementation and getting this work to the country level so we can evoke change. Education, the socialization and education of young people for equity and respect for diversity is at the core of inclusive development, is at the core of inclusive education. A real focus at the school level, at the implementation level, at the country level. Bridging the partnership at the country level is the next priority. At the same time, continuing to reinforce the messages that went into the post-2015 agenda on a clear international commitment on the right to education for persons with disabilities. Raising the profile, again, from all development partners. Influencing the international development agenda, post-2015. Making more robust our knowledge platform. A focus thematically on inclusive learning assessment. This is really an area at the global level. Early childhood education, the fundamentals of a resilient child, of a resilient society, and getting more donors involved. Thank you very much.
Thank you. A remarkable list of accomplishments in 1 year. I'm next pleased to present Mr. Anthony Dutine, who will be speaking on behalf of the Nutrition Task Force.
Hi, good morning, everyone. I'm Anthony Dutine from Handicap International. I've been working together with a number of people on the Nutrition Task Force over the last year, and it feels quite amazing that a year has passed by. It feels like a year's achievements have happened in 6 months in many ways, but we've had a fairly busy year. If you recall those last year, you'll remember stood up here was Alana Officer of the WHO, who really talked about the lack of evidence, the lack of information about what's happening, but the very inextricable links between nutrition and children with disabilities. So I'm pleased to say, on the next slide, that we've actually had a couple of very good achievements in building a little bit more evidence and a little bit more information about what's happening. But what we've realized is that's really the tip of the iceberg, and there's really a lot more to be explored. We split very quickly into 2 task groups within the task group, if you like. One really looking at a survey and mapping activity, and the second trying to build a bit more evidence. I was involved more in the survey and mapping, and Professor Groce was leading the evidence group. And the 2 major achievements have really been, and some of you have been involved, and thanks for those who were, to get a survey out on SurveyMonkey that has collated results from about 50 organizations and really sort of in-depth mapped about 7 or 8 or assessed about 7 or 8 key activities on nutrition and children with disabilities that have happened. And we've got a full survey report, about a 10-page report, that is available for those who are interested in reading that. The evidence subgroup has had even more success in that they've actually been published in The Lancet in the past month, which is a huge achievement. Professor Groce, Amy Farkas, and several others managed to pull together some information and pull together best available evidence about children with disabilities and nutrition. So that's been a great achievement for the group this year. But the year's not been without a lot of challenges. After the leadership of Alana Officer last year, the leadership transitioned, and we had a period where nobody felt that they were able to take a full active lead in the group, and so we're really grateful to Amy Farkas of UNICEF, who agreed to take a lead of this group. In the coming year, though, we hope, and we sort of really put down as a recommendation of the group that we would develop new leadership, and we hope we've identified somebody who's willing to take things forward in the coming year, Cindy from Spoon Foundation, and there's going to be a meeting tomorrow really to cement that and look into the future planning. So that's been one of our big challenges, is really having a focal point at the head. Secondly, one of the objectives, and you can see in the reports, in the annual report for the GPcwd, the achievements, and one of the things that we set out to do was really reach out into the mainstream nutrition networks. And we've done that to a certain degree. We've managed to have involvement, particularly from the UNICEF nutrition groups, but we could do more, and it's been challenging to get the attention and engagement. But we feel like the survey that we've got, the evidence that we've created, will hopefully get more of the attention of the mainstream nutrition groups to engage in this discussion. And finally, we had planned to do GIS mapping and map the individual projects down. We're all living in a slightly resource-limited world, and when Evelyn Chareau and myself, Evelyn of Global Partners United, looked into the mapping quite extensively, I learnt more about GIS than I ever thought possible in the first half of the year. It realized it was a bit of a costly exercise, so we're hoping to reignite that if we can find some funds. So finally, we've got a lot of things to work on. We really want to build on these survey results. We've got a snippet of information, but as I said, it's the tip of the iceberg. We really want to dig deeper into this really underexplored area a lot more. We really want to also develop these partnerships with the mainstream nutrition sector. And also, quite excitingly, in the last few weeks, it's emerged some interest from the feeding, swallowing, and dysphagia groups, who are quite interested in hearing about what we're doing and how they can get involved. So quite exciting times ahead. Thank you very much.
Thank you. We'll next hear from Valerie Shearer, who is the lead on the humanitarian task force. And while she's making her way forward, I've also been asked to remind you to, if you have questions or comments that you want discussed, to start filling out those yellow forms. Valerie?
Good morning, everyone. I'm going to be short and do a quick report on the task force. There has been a couple of achievements. Lots of it has been done in cooperation with our network, and more specifically with the Disability Inclusive Disaster Risk Reduction Network for Asia Pacific. Through that network and in cooperation with them, we participated to the global platform and had a child with disability among the panel of children at the featured event. And he did a very great presentation about what person with disability would need during disaster. We also produced a couple of documents, such as policy brief, vulnerability definition related to disability, and it quite a lot of work done with UNISDR also for the International Day for Disaster Risk Reduction, which this year is on person with disability. Could you go? Yeah. The challenge, one of our objectives was to basically gather all resources and documents related to children with disability in emergency or in disaster risk management. But we did not get many out of it. The idea was to have that on websites, both on mainstream websites and on UNICEF websites, but we did not get enough involvement from members in bringing those documents in. And I'm calling you, if you have anything, to send it to us, so we can really build up that documentation library, if I can say so. But for the moment, because we don't have enough material, we decided it's not worth to develop that platform. Next. What we're going to do in the next few years, next year, basically there will be some work done tomorrow with the core member of the task force. But one is really to continue moving into including disability, and particularly children with disability, in the Yoga Framework for Action post-15, which is the framework for disaster risk reduction, and then move towards the ECOSOC resolution. And I think that's all. So thank you.
Thank you, Valerie. Our next presenter is Chapel Knobith, who will speak on assistive technology. Hi, Chapel.
Good morning, everybody. We are the youngest baby in all this task force group, and why we exist. And that's my first slide is that as far as basic needs are concerned, between any child and child with disability is the assistive technology. Every child needs the same love, family, food, clothes, education, health. But if anything, they need extra, is assistive technology. And that's why we said that all the task force, you'll not be able to achieve your goal if you don't have the access to assistive technology. And with that argument, Rosangela and her team really allowed us to function and operate. So assistive technology is a basic need for children with disabilities. It's like food, like clothes, like love, and all. Could I have the next slide? So highlights of achievement is that creation of the task force, it is itself is a big achievement. Getting like-minded people and organizations together. We have made a final draft, last 6 months we worked, UNICEF and WHO worked very closely to develop a joint position paper to raise the awareness about the need for and benefit of assistive technology. And the final draft is ready, and we'll present it tomorrow when the task force will meet separately. But if any of you wants to have a look, give your contribution, please welcome to get in touch with us. And also we are getting AT included in high-level disability meeting on disability and development. And yesterday we organized a assistive technology side event during the high-level meeting because we think that this is a big thing which makes really people disabled and non-disabled. And the unfortunate thing is that 90% people, 90% children with disabilities do not have access to assistive technology. If we don't have the access to assistive technology, many of us will not be in the 44th Street to meet those security people. But many people forget this who are fortunate to have this. So our main agenda is how to draw attention of everybody that every child with disabilities have access to assistive technology. They can come out of their house, they can go to school, they can play like any other children. So challenges and the recommendation means establishing the identity, developing PR materials, networking with other task force, and also to establish the linkage. We are really struggling. We are all working more than full time. So we hope that one day we'll have somebody, dedicated person to work on this. And so better coordination with the task force and among different task forces. We are proposing that half-yearly meeting, if we can do, maybe virtual, web-based or all, among the different task force leaders. And at least once a year, we meet everybody together. And the last one. Our key recommendations is that task force priorities are that we expand our group, because still we are only 20, but we know there are more than hundreds of organizations in this field. Get joint position paper peer reviewed, publish. Establishing linkages with other task force and reinforce their activities. And the last and most important is getting assistive technology, AT included in all discussion related to disability. We are saying nothing about disability without AT. Thank you very much.
Thank you. Really a remarkable set of achievements. Our last presenter in this part of the session is Mr. Donald Wertlieb, who's going to be presenting the task force on early childhood development.
Thank you, Nora, and thank you, big brothers and big sisters who reported for the other task forces. It's a pleasure to be here with you today, which is the birthday of this new task force on early childhood development. First slide. We began just before the forum last year as a grassroots group, informal group, a gang of dozen or so advocates for early childhood, and then this summer's needs assessment and the governance planning survey identified significant need and interest in an ECD focal point, thus launching this task force as well as strengthening the bridges to each of the others, as well as emerging national partnerships. So we have been born. My 5 minutes doesn't allow time for rendition of Happy Birthday, but maybe next year we'll have a moment more. We're enacting and advancing the survey findings. We are drafting our concept note and action plan, and very importantly, we're opening the tent. So when you hear Global Partnership for Children with Disabilities, we will be echoing children with disabilities and their families as part of the participation. Next slide. We participated in the forum today, and over the next year, we want to harmonize the ECD perspectives with the global action plan of the partnership. I want to just mention a few of these elements to orient you to our concerns. First, we embrace this poetic wisdom from the World Bank that captures our perspective as well. Invest early, invest smart, and invest for all. We have cost-effective policies, programs, and practices. We know so much about what works, about how to foster healthy development of young children with disabilities and their families by including them and their families and communities. Yet there's not enough traction even within our circle here. We embrace the notion of triple twin tracking. Most of us in the room are quite familiar with the notion of mainstreaming disability as a twin track process. The early childhood development window urges us to connect with the notion that context matters. So we are twin tracking child services along with family-focused and community-based services. And then, of course, a third twin track to be orchestrated has to do with the fact that development matters. And our expertise in the youngest children, the first decade of life, needs to be coordinated with appreciations developmentally of children and youth, more broadly speaking. Next slide will orient you to our priorities for the coming year, launching the collaborative platform for inclusive engagement and resource exchange. You see the themes generating about how will we be sharing knowledge within our task force and across task forces and more broadly in the partnership. We can congratulate ourselves for survival success. So we've made major advances there in reduction in childhood mortality, but the problem of unintended consequences as we reduce infant mortality, more babies survive who would have died in the years past. Many are healthy, but many survive with disability and risk. These increases in morbidity, disability are well documented in United States data for the last century, but data for the problem on a global level need to be generated, and technological advances, globalization, and so forth are part of this problem and solution. And so we look for ways to recognize that to survive is quite important, but ECD perspectives will allow us to focus on thriving and flourishing beyond that. That gives you some idea of what we're doing. There are about 30 or 35 folks currently engaged in the ECD work. Now that you know that this will be a task force, please be in touch so that you can participate in the work with us.
Thank you to all the presenters. This has been very helpful and succinct, but excellent start to just laying the groundwork and bringing everybody up to speed on where these task forces have been over the past year. There's been an enormous amount of work behind the scenes. This is clearly evident by the 3 or 4 slides that you've seen per task force. And it's important both for the quantity and quality of the work in a short amount of time among people who are very busy and are volunteering their time and energy to this important effort. We have about 10 minutes to open the floor for comments and questions. I've been asked first to both open the floor, but also take the first question from Amy Raworth from the Lakeshore Foundation, who wants to say a few words about an additional task force that has been proposed. So if Amy is someplace and they're already
Good morning.
with me there. And in the meantime, if you've copied down or you have anything you want to be brought up in the questions to follow, please jot it down on the yellow slips that you have and pass it to wherever you're supposed to pass it to, and we'll take as many questions as we can. Amy?
Thank you. Good morning. My name is Amy Raworth. I'm from Lakeshore Foundation, and my organization, in addition to the Institute for Human-Centered Design and the American College of Sports Medicine, are here today to propose a task force on health and physical activity. As has been said, we strongly believe that the health inequities that people with disabilities experience are an embodied expression of social injustice, and we really feel that all people should have access and the right to the conditions and resources that promote optimal health. We feel strongly that by preventing secondary conditions, we can increase the quality of life, and by creating an inclusive community, we can affect generations to come. Initially, we're proposing that this task force focus on the reduction of non-communicable diseases through the important and key role that physical activity and play can help us to reduce NCDs. I will pass this over to my colleague, who will say just a few words as well. Thank you.
Great, thank you very much. I'm Jean-Claude. I'm the Chief Officer of the American College of Sports Medicine, which, despite its name, is very international and global in focus. Pretend, if you will, that we've talked much longer than this in regard to our passion about working with you and our commitment to work hard and well in building your capacity and ability to achieve the many things that you do. The task force reports were just amazingly exciting, and we look forward to working with all of you in that regard. Just to indicate, it is vital to raise the profile of the importance of physical activity and healthy lifestyle for children with disabilities. Science says that, medicine says that, public health, global health, common sense says that. And we think we can make that contribution to the valuable and important work that you're doing. This proposed task force, certainly could look at all kinds of things that would be beneficial, not only to the focus that we would have, but also the work of the other task forces and for the global partnership overall, from physical, cognitive, emotional, a whole array of things that we think would be incredibly valuable to the important work that you have underway. We also, I think, will be able to provide some organizational capacity and ability to help, obviously, some of the challenges that we heard about with just the ability to get things done. And we think we can assist in that way as well. So we're very, very excited about this. Hope that this makes sense to you. It certainly does make sense to us, and we look forward to working with you in the future. Eli?
Thank you very much.
Yes, hello. My name is Eli. I just wanted to just close our short presentation here with a quote. I wanted to be able to share the quote that speaks about the promise of physical activity, play, and sport as part of the human rights experience for all children with disabilities, for all humans. And so really being able to embrace physical activity and play as part of the whole work that we're doing as a global community. So being a part of the work around the Convention on the Rights of Persons with Disabilities, all the work that's been done over the years to make sure that physical activity is a part of this and the link to health. And so this great opportunity to work within the UNICEF framework and to invite and work together with all of you. We very much look forward, and thank you so much to all of you, and turn it back to Nora. So thank you so much.
Thank you. We have time for several questions, and I'd like to thank people for both sending in questions and putting it in very neat handwriting so I can read it. There's been several questions there. Let me summarize, and it's to the Task Force on Early Childhood Development. And the questions are, child development goes beyond early childhood. And so has the task force considered, or would the task force consider not limiting itself to early childhood, but in fact broadening the mandate of the committee to deal with children with disabilities throughout their childhood? So could we have someone to represent the, okay? Could we get a mic for you first? 2 mics are coming.
With our experience is that the global partnership has that much broader context of children and youth with disabilities, and the particular focus and contribution of the task force at this point is intended to accentuate the solutions that come from comprehensive evidence-based approaches in early childhood. Obviously, they manifest in developmental outcomes at school age, middle childhood, adolescence, and onward. So indeed, those developmental issues would be addressed within the task force and in the bridges to each of the other task forces.
Okay. Thank you. Let me take, we've got actually a number of interesting questions, and regrettably our time is limited, so I'm just choosing these as they come in. I think this is a question probably for UNICEF or for the Early Childhood Development Group as well. Oh no, actually it's probably, it's to anybody in any of the task forces, I guess. Can you speak to including the voices of families and caregivers on children with disabilities, and how these task forces might be able to do that? Can members of the task forces speak to including families and caregivers of children with disabilities? Would
This is a priority, and again, the perspective of early childhood development insists it can't be done otherwise. With all due respect to notions of participation by youth who can very well speak for themselves, it's more complicated in a number of ways for younger children. So the involvement of parents, of caregivers, of families would be I think already a place where the thinking of our group is influencing the concerns. It's not easy to do. It can be done, and it must be done. Many of us in the room or in the task force have multiple roles. We may be a parent or a family member of a child with a disability, but we're looking for much more explicit inclusion, very responsive to the disability movement's notion of nothing about us without us, but when it's someone speaking for a 1-year-old, 2-year-old, 4-year-old, that means parents are part of the solution.
Very good. Does anybody want to elaborate further on that? Or okay. Let me take one more question. Again, I'm conscious of the time, so I apologize for those who haven't had their questions read out loud. But again, all this information, all these very nice yellow cards will go to the UNICEF staff, and they'll be looking at it over the next coming days and weeks. This is a question to, I guess, Adzalla. And it says, what can UNICEF do to support governments in developing countries who have limited resources to provide support to children with disabilities to access better mainstreaming in schools? So it's
in schools?
In schools.
Well, we have the education team here too, and Nick, so we would be glad to share the microphone with them. Basically, UNICEF is working in the countries to support governments and to develop a work plan that is to serve governments and to support them to develop their own policies and practices to include to address child's rights issues in general, and children with disabilities are part of this. Right now, we will see during the next session, we will talk a little bit about the strategic plan of UNICEF for the next cycle, 2014 to 2017, And the focus of UNICEF is on equity and bringing to development the most marginalized groups. And again, it brings children with disabilities right there to the center of the agenda. Our work is, again, to support governments in getting their own goals. For example, implementation of the Convention on Inclusive Education and every other area and policy that will complement. We know that we will not achieve inclusive education if we don't work on access to health, access ECD, nutrition, sanitation, and everything. And that's what we do in country level. Right now, we had 85 countries reporting work on children with disabilities, 85 UNICEF country offices last year reporting serious work in this field. It's growing every year, and fortunately, education is one of the main things. We have the education team here if they want to complement it. Thank you, Nora.
Thank you. Unfortunately, given time constraints, I think I'm forced to stop here. Again, many of these questions will be discussed in future. We're collecting all the yellow cards and we're putting them in a stack. But I'm also charged with keeping things on track. So thank you to all the presenters of this first part of the session. It's been very interesting and, again, really striking how much can be and has been done in a very short space of time on age-old issues that are cried out to be addressed. So this is really a very important, historic attempt to really bring together the global community around these issues. And I'm just speaking as someone who's observed a lot of these task forces. I'm just so impressed, and I'm particularly impressed with Rosangela and her staff, who've really brought it all together and kept it moving forward. The second part of this session is to present 3 national partnerships and discuss how the global partnership is being brought together on the ground. And I can't stress enough how, I think, ingenious the global partnership is in tackling issues that are both global and then translating it and bringing together a national, local perspective as well. And I think that part of the reason that there's been such buy-in has been that there's been so many people working at the national levels to really bring together groups, organizations, academics, individuals, to really put their expertise and energy into this partnership. We're pleased today to have partners from 3 countries, Kenya, Rwanda, and Vietnam, and to speak briefly about the partnerships. The first person I have the pleasure of introducing is Jean-Claude Adzalla, I hope I pronounced that correctly, coming from Kenya, who's Regional Director for East and West Africa for the Deaf AidKenya Society, and he will tell us about the national partnership. Thank you.
Thank you, Nora. Thanks to everyone. Before I start, I would like us to all have in mind and those who lost their lives and those who are still recovering in hospital right now in Kenya, and pray with us. The disabled, we only give them what is necessary to survive in the society. We don't expect much from them. And this was an official from Ministry of Education who was attending one of our workshops. This time he had the wrong audience because all the guys in the room were civil society organizations and DPOs, and he didn't have it easy. But we managed to, through this, he actually presented a strong point that issues of people with disability, and especially with children with disability, as far as education is concerned, is still the least priorities in our countries. Deaf Aid, which deals with the deaf, actually took on ourselves to champion the National Partnership for Children with Disability. We have been working a lot with the UNICEF. And when the UNICEF came with the guidelines, clear guidelines, concise on where to start from and how to lead the process, we thought it was the right opportunity, and we seized it. We seized it by convening a workshop. Normally, when you call different organizations into a partnership as an organization, they expect you to drive the process, and we know the implications. So we call everyone to reflect on inclusive education. So everyone has something to give at that meeting. So everyone was eager to contribute as organizations. So one thing we realized quickly is the step taken, it needs a champion. We need someone, an organization to champion a partnership, to bring different people from different disability subsectors together. It needs the right momentum. And believe it or not, the momentum was provided by this ministry official, who is supposed to be the one who is the duty bearer to give access to education to all children, when he said that they don't expect much from children with disability. So we got a momentum right away. And then it needs resources. So we started on the 29th of May, 2013. And the members of our partnership come from different horizons. I can name a few. We have Leonard, Cheshire, which is one of our members. We have Plan, we have Deaf Aid, Autism Society, Save the Children, Sight Savers, Toure Africa, Life Skill Promoters, VSO, Girl Child Network. So it's a comprehensive group of organizations that came together to further the agenda for the children with disability. So we started now, after that meeting, to put up structures. We crafted a statement of purpose because we realized that for other organizations to join us, they need to know what we stand for, and they need to adhere to a certain purpose. So this is what we crafted first. We define our goal and our objectives, and we also develop a rules of engagement. And then there was a discussion about, are we going to register this entity? Is it going to be a loose partnership? How can we deal with government if we don't have any moral authority, if we don't have an institution? And this varies from country to country. But in Kenya, it's very important to know who you are, to have a number associated to your name, and to be an existed, a recognized organization. So we went to the rule of engagement, and we crafted a constitution, and we're in the process of registering the partnership. Key achievement. We have one big achievement that we're very proud of. We have obtained funding from GPcwd as a partnership to start an SNE survey. This is long overdue in Kenya. We are still working now until we got that funding with estimate, right? No one can put finger on pictures, okay. We also have been invited to the Education Donor Coordination Group, and also the government has invited us to sit on the validation committee of the National Education Support Program. Common priorities. I would like to just mention one quick thing. We have two groups, we have a thematic group, and also in thematic group we have different task forces. And our thematic group do what we call the POUN. It's policy, advocacy, watchdog, and network. And then at the task force level, we do what we call the RAC, research, action, and knowledge. So this is what the task forces are about. I would like to continue on and on, but I've been told I have 1 minute. Thank you very much.
Thank you, and thank you for staying within time limits as well. Our next presenter is Ramatou Toure, Chief of Child Protection at UNICEF Rwanda.
Good morning. Before I start, I would like to thank the organizers of this forum for providing us the opportunity to share our experience in Rwanda. So in the next 5 minutes, I will try to present very briefly our efforts to promote the participation of young children and youth in Rwanda through the National Children's Summit. So every year in Rwanda, UNICEF supports the government to organize a National Children's Summit. During the Children's Summit, the children and the youth have the opportunity to identify the key concerns, the key issues that are of concern to them, and also to present them to the highest level of policymakers. The President of the Republic of Rwanda and the Prime Minister regularly attend this summit, and it is a very serious summit because actually the children identify the issue, they present them to the government, and then the government has to provide responses and show how it will address the concerns presented by the children. Those commitments form part of the performance contract that each national institution in Rwanda and each public servant is evaluated against. So in 2012, actually, UNICEF and its partners decided to facilitate the inclusion of some of the children who had been traditionally among the most marginalized in the country. These include refugee children, children living in the streets, but also children living with disabilities, whether it was a visual, hearing, physical, or developmental impairment. So we faced a number of challenges once we've made this decision, because this decision had huge implications in terms of the organization of the forum, but also in terms of logistics, because children were supposed to come from all across the country. So the main issue was about coordination. So we knew that not one single organization in Rwanda could basically do it by its own, especially because the government had just established a national council for persons with disabilities, and this institution was brand new. So what we have decided as UNICEF was basically to play a convening role and try to bring together the CSOs, the national NGOs, the international NGOs, the schools, the parent-teacher organizations, all the organizations that basically were sharing the same goal. Because we knew that it was only together that we could make it happen. So in terms of the result, the results were extremely conclusive. In fact, the issues faced by children with disabilities were put on the national agenda, and the government was summoned to respond to them. The children with disabilities in the National Forum actually argued for them to be included in every child forum that takes place at each level in Rwanda, whether at district level, at village level, or at community level. And finally, the fact that the elected president of this summit was a child with a hearing impairment sent a very strong signal to the public, to the general public in Rwanda. So what have we learned through this process? Two things. The first one, that it's critical at country level to be together and to collaborate together to basically harmonize our actions. The second thing that we've learned is, like, sometimes it's very important to use existing advocacy platforms, existing resources, existing organizations to basically promote the rights of the children and the adults living with disabilities. Okay, so where are we now? Now we are at the point where we have decided to formalize and establish the National Partnership for Children with Disabilities and develop an action plan. This is very important because there are a lot of actions that are currently undertaken in Rwanda for children with disabilities in terms of research, in terms of mapping, in terms of service delivery. And we think that this, having the national partnership, will basically guide our actions. We will also organize a high-level advocacy meeting that will precede this year's National Children's Summit to take stock of the commitments of the government and trying to evaluate the progress that have been made. And finally, within UNICEF, we have established an ability task force to ensure that our collaboration within the National Partnership for Children with Disabilities is truly multi-sectoral. Thank you.
I'm pleased to call our last speaker of the morning, Mr. Nguyen Ho Yu, who will speak, who is the Director General of the Vietnam Child Care and Protection Agency, and will speak on the partnership in Vietnam. Yes.
Ladies and gentlemen, it's my great honor to participate in this forum. On behalf of the government of the Socialist Republic of Vietnam, I would like to express our appreciation to the UNICEF and other partnership for all their hard work in preparing for this forum. And regulation policy framework and partnership on children with disability in Vietnam. I would like to share some information. Firstly, I would like to word some words situation of Vietnam. Population in Vietnam about 87 million, and GDP growth every year about 6%, and poverty rate about 9% in 2012. And secondly, very important, I would like to present on the situation of children in Vietnam. At present, Vietnam has about 25 million children, accounting for 29% of children population, of the population, total population. And children in especially difficult circumstances, nearly 1.5 million, accounting 6% of children population. And children with disability, about 1 million, accounting for 5% of total children population. And thirdly, I would like to introduce some the legal framework, policy and legal framework in Vietnam for the children, especially for the children with disability. Vietnam as one of the first country to ratify Convention on the Rights of the Child in the 1990. After that, in 1991, Vietnam issued the law on protection, care, and education for children. And this law preparing in 2004. Inside the law, protection, care, and education in children, Vietnam had the law on persons with disability in 2010, the law on adoption in 2010, and some policy on the social allowance, support, education, support, health insurance, in a particular policy on rehabilitation for the children with disability. The key issue of the law and policy, on most policy and the law, most to create fair and equal environment for the children, especially children with disability, to ensure social security for children, such as food, housing, clean water, health care, rehabilitation, and extra. The Vietnam had some national program to support for the children. Regarding the partnership, Vietnam has had close cooperation with the various partners on the child protection care. Since the national program on child protection was adopted, it has been a strong basis for us to work with various partnerships in implementation activity. We have meeting with relevant partners to discuss what can be done by whom. In the position of the government, we welcome cooperation with their own partnership, including NGO, DPO, social organization. We also create various conditions for partners to work with Vietnamese organization and for people with disability, especially children with disability. Ladies and gentlemen, taking this opportunity, it is my pleasure to inform all of you that Vietnam will ratify the Convention on the Rights of Persons with Disability in 2014. On behalf of the government of Vietnam, I would like to reaffirm Vietnam's commitment to participate actively in regional and international cooperation to promote the rights of the children with disability. Thank you for your attention.
Thank you to all the speakers, all very interesting work. We have about 8 minutes by my watch, and we're going to take questions, a few questions from the floor. So I apologize to the group upstairs, but they've already sent down a few questions as well. Could we open the floor, and do people have questions, comments? Yes, and please identify yourself and your organization when you get up.
Good morning. My name is Charles Bailey. I'm with the Aspen Institute. Mr. Hugh, I'd like to ask you to tell us a bit more about the national law on disability and some of the early accomplishments of your ministry in implementing that law.
Okay. And could I just because of the amount of time, could I just ask that just keep maybe just a few quick remarks as it specifically pertains to disabled children, and the partnership would be very interesting.
Thank you for your question. On the relation person with disability in Vietnam, very trying to do for them. Recently, as some past year, Vietnam has complete policy for the people with disability about the support, education support for healthcare, rehabilitation, and the transportation. No barrier. And nowadays we are working with ministry to work, be preparing for the ratify the convention, and the right of the people with disability in the early next year. Okay, thank you.
Okay, thank you. Other questions? This young woman right down here, right behind Susan.
Thank you very much. I'm Abia Akram from Pakistan with the Disabled People International as a global coordinator for young women with disabilities. My question is how you are including the concerns of disabled children, female, like the girls with disabilities or the young women with disabilities. So what are the strategies to include them as a cross-cutting theme or mainstreaming in all the task force and plus their implementation plans, so we can strategically include them and make some sustainable plans for them in future? Thank you.
Thank you. Would someone from UNICEF like to respond?
No, that's fine.
We'll put Rosanto on the spot.
Okay. Abia, you are a founder of the partnership as well. And we are working very closely with the gender groups and I don't feel comfortable answering this because the task forces are not about UNICEF, and they are about the global partnership. Here we are, the global partnership. That's why all of us are coming together to make sure we influence cross-cutting issues and everything in everything we do. Chapa was talking about assistive technologies, a cross-cutting issue. Of course, when you talk about nutrition, ECD, girls and women, of course, have to be there. It's our responsibility and yours too to make sure that this happens. So thank you for raising the issue. And again, the task forces are not about UNICEF. They are about all of us. So I'm just taking the microphone because that's a very broad question to everybody here. It's very important to keep always in mind that when we talk about equity also, we are talking about minorities, indigenous, girls, and every other group that cannot have a voice, and that we can potentialize their voice and give them visibility.
Very good, thank you.
That includes the elder.
Not in children, but...
Let's see, other questions? There's a question way in the back.
Hi, Susan Parrish, Lurie Institute for Disability Policy at Brandeis University. I very much support the motion, I suppose it is, to create a new task force on health, and I'm wondering if we could move forward with that. Is there a discussion or a process? It seems that that's a terribly important issue. We know that disability-related health and healthcare access disparities are pervasive globally. Thank you.
Okay. I don't know if we need an answer to that unless Rosangela wants to take that. Maybe that is something to just throw out and have all the task forces discuss and have UNICEF discuss. We'll let Rosangela take the lead on this.
Oh my God, it seems that I will be in this microphone today. So the thing is that what we have been doing, the Secretariat of the Global Partnership is consulting partners in every step of the way. So we consulted about the logo, the structure, the task force and everything. As we had time to consult on the ECD task force in advance, we considered that this was already agreed, and then we asked that the new proposal of a task force on health to be presented from the floor so we all could agree with the new task force. So if the group thinks that it's a good idea to have a task force on access to health, I would just suggest that everybody say hi, and then we adopt it.
Excellent, thank you. There's a question right back there. And could I just say that while we're all talking with great passion about this, if we talked a bit slower, the sign language interpreters might survive to the end of the day. Please.
Sorry, my apologies for not getting up, but I don't have my crutches. I'm Anne Hawker. I'm representing the New Zealand mission, but I never forget that I also represent Rehab International. The question I'd like to ask is from Kenya, could he provide a little bit more elaboration on those two important task forces that he just mentioned very briefly?
Thank you. We actually don't have two task forces. We have three for the moment. And our structure is a bit different from what is recommended by the Global Partnership, but we try to adapt that to our realities. We have thematic groups, which we have education thematic group, we have accessibility thematic group, we have education, accessibility, we have, we have 6 thematic group, and then we have 2 task forces that are already active, and we have one that has been established because the government has started a process that they call Computer for Schools. And what we say is that the disabled children should not be left out of this Computer for School this time. So we set up a task force for that specific thing. So what I was mentioning was we gave specific tasks to, not a task, platform rather, that we call a RAC. A RAC is task forces have to be about research, action, and knowledge. But then at a group level, at the thematic group level, we call it the POW, which is be about policy, advocacy, watchdog, and network. So this is how we define what we expect from different entities. And one group, thematic group, can have many task forces that created as soon as we have a need that arises. Thank you.
Thank you. Let me take one more question, and then we'll have a coffee break. Do I see, in the back? Woman with the blonde hair right there.
Hi, Evelyn Chiro, Global Partners United. I'm wondering if any of the partnerships or task forces have engaged the private sector. Since we are also resource limited, I'm wondering if anyone's had success in bringing the private sector into the partnerships and looking at corporate social responsibility programs or other new strategies like the ones that were used with HIV/AIDS pharmaceutical distribution to low and middle resource countries. Thank you.
I'll call on the speakers, representatives from the 5 task forces. Does anybody have any experience with that? Yes.
So for the education, we've been having discussions with Microsoft. The co-chairs have been strategically sort of reaching out to the private sector. Microsoft would be an incredible partner on things like assistive technology for special needs education. The use of technology, obviously, as an accommodation, but also as a tool for pedagogy, for inclusive education. So these are really natural partnerships, and as a multi-stakeholder, cross-sectoral agenda, it's absolutely essential that the private sector are involved. The private sector are also a big stakeholder in the GPE, and of course, through that, we'll also have those partners brought into the fore. It would be good to see more private sectors in forums like this, for sure.
Okay. From any of the other task force? Perhaps not, but it's very good to hear education has taken a stab at this. I'm sure we could continue on, and I see other hands out there, but my task is to end on time, relatively on time. Just in summary, I think that the past year has shown a remarkable progress and very innovative work, including dozens, actually hundreds of people around the globe in this partnership. I look forward to seeing what's done in the coming year. This much progress has been made within this short frame of time. And I thank all the speakers for coming and sharing their experiences. And thank you all for your attention.
Okay, I have to say that I'm impressed for the first session. There was a lot of speakers, a lot of information, and we managed to really get it all in a timely fashion. I think that, you know, it's really worth noting, for me, this is what my takeaway from the session, is that there are some innovative things, as Nora has said, going on. I think these innovative approaches are things that can be not so much replicated, but perhaps they can be used to drive practices in other countries. I think what comes to mind first is the experience of Vietnam and working in legislation, on the legislation. The experience in Rwanda, where they take something that's already going on and they lead from behind and help the government really to, you know, drive the whole process. And then I think the Kenya experience is important because they're very organized, number one. And I have to say these are accomplishments that in 1 year I think are, as you say, very remarkable. So I want to give everybody a chance to have a little discussion over some coffee about what you've just heard. I'm sure that there's a lot of food for thought, food for coffee. And just so that you really understand our limit of the room, the logistics of the room, and the time constraints, all of the questions, I have clustered them. We will somehow weave as many as we possibly can, comments and questions, into the coming sessions, but we will definitely use these questions and these ideas to in the elaboration of the work plan that's coming up, and to get back to you in some sort of interactive way to discuss further how we can build on the results of this session. So with that, I'm going to leave you. We are going to reduce the coffee break to 25 minutes. 25 minutes, and I will come around with my little chime and let you know when it's 5 minutes before. Enjoy. Yeah. We will, hello? Sorry, I'm reminded that during the coffee break, we will have a video that's going to be playing. So you can either sit here and watch it. It's a very short video, or you can go and get your coffee and come back. It'll be playing during the coffee break. Thank you.
Healthy, safe and eating well, educated. I don't think that's so wide.
Now Einstein is, and I'm there to think we all know. But after school people, would you ever call him slow? Alexander Graham Bell, not that ringtone very well. Thomas said this song was cool. Got the light bulb and he no fool. Stevie Wonder, Helen Killer. FDR when he was stellar. Louis Braille, he was 15. Made an alphabet supreme. So my point is clear. Please don't judge, you'll cause too deep.
To all of the people around us, we say it's ability.